Welcome back to New Day Cleveland. Okay, GAINSWave is a safe way for men to reverse the effects of erectile dysfunction. So we're going to welcome Dr. Kroth, Stephen Kroth, and Jennifer Frey from PA Green Wellness, which means PA means Pennsylvania, right?
That's correct.
So you guys came all the way from Pennsylvania because people from here go all the way to Pennsylvania to get some help, right?
Yes, they do.
Yes.
So I'm driving to work today and I'm listening to, there must have been like 4 commercials in 1 hour about erectile dysfunction. Talking about,
Absolutely.
you know,
Oh, yeah.
52% of guys under 40, all kinds of stuff. So there are a lot of questions and a lot of misnomers about this, right?
That's correct.
Yes, it's a shame-based topic, and it doesn't need to be. There's a lot that can be done for men now. There's a lot of breakthrough.
Yeah.
Recent breakthroughs.
Well, I guess when they came out with the different drugs like Cialis, et cetera, like, you know, that was a big boom then.
Right.
But you've come across something else that works even better.
That's correct. The pulsed acoustic waves, so the GAINSWave method.
So tell me a little bit about the GAINSWave method. Why does this work and how does it work?
Well, the GAINSWave method is a treatment protocol that utilizes pulsed acoustic waves or sound waves in the tissues. And as those sound waves pass through the tissues, they create what's called a cavitation phenomenon, where it creates little bubbles behind these sound waves. And as those bubbles collapse, the jets they create kind of scrub the walls of the blood vessels, but it also stimulates the body into a kind of healing and rejuvenation process, creating new blood vessels, old cell turnover, generation of new cells.
So what is the deal on this? We're talking about people as young as 40 have it, older people get it. When should somebody react to it to the degree that they're going to come see you guys?
Well, men should come in any time that they're not happy. There's no reason to be unhappy. It affects relationships, it affects their approach to life, it limits how chances that they take. And so, you know, we see men coming in as young as in their 30s. And there's a lot, everybody of any age can see something positive from it. So when should men come in? When it's starting to affect their relationship.
So how about people that are already taking Viagra and Cialis, and some people who already had like surgical problems? Would your alternative be a good way to go?
I think so. With something like the GAINSWave therapy, people who are currently on medications can see very often an increased benefit from the medications they're already taking, and possibly a decreased need for relying on those medications.
Yeah. It seems to me, we talk about these different things, like we're going to talk about stroke later, we talk about blood pressure, we talk about diabetes, and it seems like women are more often the ones that go to get the help and to get the information, but guys sort of hold back a little bit, like they're too tough for that, right?
Right. So in our culture, it's completely natural for a woman to seek care throughout her entire life on her reproductive organs. So it's a completely natural approach for a man to do the same thing. The human body is a machine. It needs maintenance.
Yeah. I knew a couple days ago I was going to talk to you guys, so I was thinking about that, and I was just in London with a bunch of people, and I'm with a whole bunch of guys, young guys, middle-aged guys, older guys, and they're all talking about, can you buy Viagra over the counter here? Can you buy Cialis over the counter here? So it sort of reinforces that whole idea to me that a lot of people are thinking about this at a lot of different ages for a lot of different reasons.
That's correct.
It's sure, and there's, you know, it's unfortunate that men have ED, but it's a great time to seek treatment for it.
Okay, so set me up. How do people go? Who do they call? And what should they expect when they call?
So people, you can contact us through our website. I think you have our phone number
There it is, right.
up on the screen.
PAgreenwellness.com.
So we're different from other providers. When you call in, you actually speak to a live person. We do a consultation. We screen out, we get your medical history, and we make recommendations. We let the patient determine what they would consider to be success. Some patients want to be off their medications, and some patients just want their medications to work again. We have a segment of the population who comes in just for erectile performance, just for an enhancement, to prolong or put off what they think might be a problem later. Men usually know when something starts to falter, and there's no reason they can't talk about it and ask for help. I mean, what did you say? Doctors are ready.
Yeah.
Doctors are ready to hear about it.
You know, it used to be such a taboo topic, but doctors are ready. They've seen it all.
How about paying for it? How do we go about that? Does insurance get involved in this at all?
No, unfortunately, insurance doesn't cover it. but we have.
Because it will cover the drugs sometimes if it's prescribed by a doctor.
Right. And
that's
so this
odd.
is another reason why we don't take a position as far as what a patient should want.
Right.
A patient comes in and they tell us what they want to experience in their life. It can be just freedom. It can, the common things I
Right.
hear is spontaneity. The golf course, the woods, the
Right.
couch, the car, they want spontaneity back. And, so we have multiple levels of financing. So we even do in-house financing. So if somebody is a good candidate and we think they're going to have a great response, we like to
Right.
make sure that they can afford to pay for it.
This may be the toughest question, not the one everyone's expecting, but how about a ballpark? Like somebody's going to want us to call you guys. What kind of financial commitment are they going to get into? Is there a range on this?
It depends on the number of treatments that we think that they will need, but you can expect it to cost between $3,600 and $5,000.
Okay, so that's what it is. And I imagine if you're on doing a prescription or something like that, and
Right.
I guess peace of mind is worth.
Nothing
Twice that,
grows
right?
blood vessels.
Right.
We grow blood vessels. So all the other options, there's multiple layers to ED. A lot of factors come into play. You can talk all day with your partner, which is a good thing to do, but it's not going to grow a blood vessel.
Yeah.
All right, we turn over tissue, erectile tissue becomes stronger and healthier, and blood vessels grow.
Well, from what I hear,
That's the home run.
Yes, from what I hear on the radio, there's going to be a lot of people calling you because there's a lot of people out there that are looking for some help or some guidance. So thank you very much.
Well, you're welcome. Thank you.
It's a
Appreciate
pleasure.
it.